Thank you very much. I'd like to share with you the continuation of our series on the Tao practice and modern endocrinology of sex hormones. Today we'll be talking about andropause in men. Very few people know that there's such a thing, but we know this, and we want to explain this to you as a sex hormone change that not only occurs in women. So, how did I find out about this? When I was a missionary doctor, I found out that the female hyena had a high level of androgens, and they behaved just like a male. They are the maternal, matriarchal society, and when they had a high hormone level, their clitoris actually was quite big, and they were the bigger animals. The males were just for reproduction. The other thing, in 1978, I castrated 100 men for prostate cancer, and I could see a very quick, in 1978, I saw a human model of what we see in men who have a fast andropause, which is castration, and they represent a typical picture of what happens to you in a 50-year period. What happens is you become this very quickly. In my situation, I saw this within 1 year. This is the typical look, gynecomastia, and you can look at some of these slides at your leisure, but I will go fairly quickly to show you that there is a energy depletion with no testosterone. And we saw this in the mitochondria, in which if we castrate somebody, their mitochondria changes drastically such that they cannot reproduce the energy that you're supposed to have, and when we give it back, it returns to normal. So why are hormones so important? If you look at this in detail, take your time. The most important thing is, I believe, that there's an increased mortality. You will lose a lot of musculoskeletal and smooth muscle function, mainly the heart, and your mental functions will change. So most women and men have it. We know very clearly from many, many studies that there's a gradual onset of decline within age 20 to 90. In fact, there's a transgenerational change. This is a very important article that you should all read, and it's called, Androgen Deprivation, Insulin Resistance, and Cardiovascular Mortality, an Inconvenient Truth by Basaria, who shows that when a man goes through major depletion of hormones, they become diabetics. And here's a great slide of the penis. When you castrate an animal, they develop fat within the penis. And it can be reversed just from giving the testosterone back. Much of your muscles that you don't think about are your gastrointestinal tract, pupils, heart muscles, and diaphragm. So we don't only talk about muscles of skeletal type, but we're also talking about the smooth muscles. So we also know that erectile dysfunction, cardiovascular artery disease is related, as well as bone changes. And this is a very unusual study done in 1998 in which they took young men and basically castrated them, and they became old very quickly in 6 months. And you could take your time. It's a very beautiful study where it shows the insulin going right up. And this also shows the beginning of what we understand of androgens causing higher mortality and death. And if you're not sure about this, one of the things that's important is that your doctor may say testosterone causes prostate cancer. No, okay? It does not. And this is a longitudinal studies done at Johns Hopkins, which also shows that, because your doctor will always talk to you about that. I give this to you because you need to know it. There's certain things that cause this, and I won't go into it, but the most common is sleep apnea. Goes through a pituitary axis to tell what's going on. I would ask you to read these 2 books. Blood sampling to give you a snapshot. It's done.